This is Hello Healthy, a Dignity Health podcast. Here's Bill Klaproth.
St. Joseph's Heart and Vascular Institute has a new breakthrough technology for carotid artery disease to help prevent stroke, and it's called transcarotid artery revascularization, or TCAR, and it helps treat patients with carotid artery disease who are at risk for traditional open surgery. Sounds really interesting. Let's find out more with Dr. Amod Tendulkar, a cardiothoracic surgeon at Dignity Health. Dr. Tendulkar, so St. Joseph's Heart and Vascular Institute is proud to be the first in the Central Valley to offer the TCAR procedure. Exactly what is it?
Yes, it's a procedure that combines stenting but without having to go to the groin for a carotid disease, meaning there's a blockage in the carotid artery that is considered significant that puts patients at risk for stroke. And this procedure allows patients who may not be typical candidates for open procedure to have this procedure done with low operative risks.
So you don't go in through the groin, you do this more locally near the neck area?
It's a combination. So it's a small incision that's made on the carotid artery rather than a big neck incision that's made in a typical procedure. The incision keeps it away from a couple of important nerves that can get injured with an open procedure. It's with a catheter-based technique, and it has a special procedure or an option where the flow while we're putting the stent up is reversed. So there's no clot or any plaque going up to the brain while the stent is being deployed. It does require a small poke in the groin for that blood that's getting essentially reversed from the carotid from the brain. It has to be put back in, so it gets put back into a vein in the groin. So it's not a big incision in the groin, and it's not a big incision in the neck.
So then this prevents the patient from stroke during the procedure?
Yes. Typically what happens is when we do an open procedure, the artery is clamped to allow a bloodless field. And in the process of clamping, you can send up some plaques going up there. The typical stenting that's done through the groin can scrape plaques that can cause stroke as well, even though they may have devices to catch those strokes while they're putting the stent. But the reversing of the blood flow actually sucks out that plaque and prevents the stroke from happening during the procedure.
Aha, right. You're not accidentally sending plaque up into the brain. You're screening it out. So who is a good candidate for this procedure?
Patients that are considered high risk for open carotid procedure are good candidates for this procedure. Some of the examples include patients who may be age over 80, patients who may have lung disease, COPD, that may not be good candidates for general anesthesia. This procedure, once the surgeons are comfortable, can be done with some sedation, local numbing medication. People who may have had prior neck radiation, but they do have an area that we can get to the carotid artery at the base of the neck with a small incision. Those were the patients who can get this procedure done. These are the good candidates for the procedure.
So Dr. Tendulkar, since this is minimally invasive, is it a shorter procedure, and does it allow for a shorter recovery time?
It's a shorter procedure. Once the skill is down, the timing can be as short as 10-15 minutes for the procedure, and definitely shouldn't be more than an hour. When we do our carotid procedures, they average about an hour. Patients end up getting a relatively decent-sized neck incision that can make some sore spots in the neck from surgery. This is a much smaller incision, so from that perspective, recovery is shorter. I think the hospital stay is not very different. So the hospital stay ends up being an overnight stay, whether it's done, stent is done to the groin, whether the stent is done with a TCAR procedure or an open procedure.
So this stent then, this protects people from future strokes. You're inserting the stent in that carotid artery?
So the stent opens up the blockage, and the plaques that can come off and go to the brain and cause the stroke gets sort of squished by the stent. So that's how it prevents future strokes.
So is the carotid artery more prone to plaque buildup?
Most of the arteries are prone to plaque, but it is an important artery because it supplies, obviously, the brain. So it is important to monitor that and follow that. So patients with diabetes, high blood pressure, smoking are all at risk for carotid artery disease. Patients who have heart disease automatically also can have carotid disease. Patients who may have peripheral vascular disease can have carotid disease as well.
Great information. Thank you, Dr. Tendulkar. And to learn more about the TCAR procedure and to get hooked up with one of our providers, please visit stjosephscares.org/heart. That's stjosephscares.org/heart. And if you like what you've heard, please share this on your social channels and be sure to check out our entire podcast library for topics of interest to you. This is Hello Healthy, a Dignity Health podcast. I'm Bill Klaproth. Thanks for listening.